Hey, Dr. Shepard DeLong here at Lotus Dental Wellness and Ceramic Dental Implants of Oregon. I wanted to take a minute to share with you a recent publication that we had here. Um, I had the opportunity to publish a digital workflow for robotically placed ceramic implants in the latest issue of Ceramic Implants magazine. And that was really exciting for me and for our team. It is the first published fully digital workflow for ceramic implants placed robotically here in the United States. And we utilize Z Systems implants and the YOMI robotic system for placement. And the editor asked me to also write the editorial for the magazine. And I was so honored to have the opportunity. And I want to take a minute to just read it to you. I titled it The Overview Effect. Artemis II recently circled the backside of the moon. A small blue, green, and white sphere floating in space appeared, our home. The crew experienced the overview effect, struck with awe, wonder, connection, a feeling of how precious life is, and a desire to preserve the health and vitality of this small planet. We must take a similar leap of faith and try promising solutions in dental medicine and ceramic implantology. A bold vision can cause a sea change, altering institutional and societal constraints that have kept human life limited to disease, managed by a broken healthcare system. The belief that wellness exists within has informed medicine from the start. However, as dentists, we've had the obligation to perform physical procedures, tooth by tooth. What a paradox. We listen to patient stories, the cost, hours, and pain, but also the appreciation, hope, and desire to be well. To heal the connection between systemic and dental health, we must use all technology available today, guided by the human heart. Early adoption of ceramic implants lacked support, but evidence has shown favorable biological interaction and clinical success. Surgical technology has evolved, static computer-aided guides, the X-Guide with a game-like workflow, and now robotics. Add the operating microscope and surgery becomes ultra-precise and ergonomic. Novel things happen when multiple apex technologies merge, and like magic, previously unknown benefits appear. Something new is born when robotics are combined with the biocompatibility of ceramic implants. Data shows that robotics improve surgeons' quality of life and length of career, decreasing institutional costs, procedure times, and patient morbidity. To successfully treat the global population, we must follow other surgical specialties and push forward the parallel advancement of biomaterials, prosthetic design, robotics, and dynamic navigation. Full arch reconstruction is often the best treatment for patients and is analogous to total joint arthroplasty. However, most systems in dentistry are still titanium specific. The development of efficient, machine-assisted full arch solutions for zirconia implants may reduce costs and improve global oral and systemic health. The biological dentistry and biohacking trends are making blood work now standard practice. Vitamin D, HbA1c, CRP, LDL, cortisol levels, and other biomarkers help us understand real health and healing capacity. PRF, nutrition, probiotics, hygiene protocols, and complementary therapies like hyperbaric oxygen, sauna, and red light reduce inflammation, improve surgical outcomes, but more importantly, help patients maintain health for life. AI can accelerate and correct this path we're on using analytics, supercognition, and predictive modeling, circumventing the traditional scientific method. What is our highest aim? What lies beyond disease and surgery? We can share a new dream, that short circuits perceive limits and make a quantum leap to a new reality. Artemis 3 is preparing for its next mission, and there will be resistance, but it will launch. We must keep going. Let's shoot for the moon, and if we fall short, at least we'll be amongst the stars. I wanted to share that because that is my truth. I think that we are on the cusp of a very special time, not just in dentistry and ceramic implantology, not just in human healthcare, but I have a strong vision and a faithful vision for the future of this planet, for the future of humanity, and I am so glad to be able to share my small part with you. Thank you.